One of the proudest moments is when an innovative idea from our department has the potential to impact the whole network. The whole process about innovations is that ideas are submitted by every colleague at every level, and these ideas are not judged. They are subject to failure, and failure is an acceptable part of this process. But it brings out the best in people to say, I can do this.
On our innovation units, we encourage our teams to go out there and try new things and not be afraid to ask, why do we do this? And my job as a leader is to support that and support my team and give them resources.
These are things that can go on your resume. These are things that you can publish if you want to in the future. So it all comes from bedside because that's where the work is being done.
When they started something like the innovation unit on my floor, we were able to get a voice, and I wanted to be one of those voices for those newer nurses, that didn't feel confident about expressing themselves. So I did ask people what they thought was more effective in our nursing care and our everyday life here at work, and that's how we came up with the preceptor model.
Working with my colleagues and connecting with them on a different level has just been so inspiring, and it's made me more energetic and excited to work on Innovation Unit and to be in the network.
I think that innovation's tied to safety in the sense that you're always looking for making problems better, and when we're fixing problems, we're keeping our patients safe.
We kind of ripped apart our equipment room, and we made it the way that we think that would help the nurses the best. So we kind of organized it where we knew this is a section where we have urinary supplies, where we have respiratory supplies, we have daily care. Once we did that with one room, we were able to then utilize it in each utility room after that, so that we're all the same.
What I see in the staff is that they are just more engaged, they're smiling, they're happy.
Some of the innovations that I was really happy to see was something as simple as making things more efficient. Patient belongings is something that can be very difficult. A lot of patients leave, there's always something left behind. And these are personal belongings that are important to patients. I was really excited because we had some rings, some heirloom rings that belonged to a patient who had been discharged. And I followed up and tracked down the owner, called them, and they were so excited because they thought that those rings were lost and they were family heirlooms. And the daughter came to pick it up right away, met me that day downstairs in the lobby, and was just super happy and gave me a big hug and just was really happy to have something that belonged to their family returned to them when they thought it was long lost.
A lot of times nurses get stuck in a groove of this is how things always get done, this is how we do things, but we're able to break that mold and say there's a better, more efficient way to get our job done and still be there for the patient and have more time for the patients and their family.
The nurses love it. I got a text message just yesterday saying how much they appreciate us. Like, they know that we're listening to them. They can actually see the changes that come out of innovations.
And it really brings us together as a team and a unit to have one goal in mind and to help our patients more efficiently.
I think overall I see endless possibilities with the innovation unit. New ideas are always going to be thrown on the table. And with each new nurse that comes onto the unit comes new ideas, new experiences.
Yeah, I feel strong. I feel empowered. The innovations unit has made me feel empowered to do more, to be better, and to never stop thinking outside the box with those ideas. Changing the world, one innovation idea at a time.